You're listening to Body by Poly. I'm Dr. Alain Polynice, here to share what I've learned over 25 years in breast and body surgery. Real talk, honest recovery, and the truth behind lasting results. Let's talk about breast reductions. In my practice, breast reductions have about a 95% patient satisfaction rate. It's one of the procedures where patients feel immediate relief, and I hear it all the time. They say, I wish I'd done this sooner. So, what is a breast reduction and who is a good candidate for this? When a patient has really large breasts that are causing symptoms such as back pain, shoulder pain, rashes under the breasts, especially when in warmer weather, or deep grooving in the shoulders, or the breasts are so large that they interfere with activities or exercise, then that's a good candidate for breast reduction. So, breast reduction is a procedure that removes a significant amount of breast tissue, but obviously leaves enough breast tissue to fit the patient's frame. And the remaining breast tissue is then shaped and lifted to create a really pleasing breast mound. But the key thing is to reduce the breasts, lift them and shape them so that they're holding themselves up. And like I said before, it's one of the operations that patients are the most satisfied because you literally take the weight off their shoulders. Now, breast reduction is one of those procedures that can be covered under insurance because the symptoms that I mentioned before could be considered medically necessary. So, when considering a breast reduction under insurance, there are certain criteria that you have to meet. You have to have had your symptoms for 12 to 18 months. You have to have sought medical attention for those symptoms, such as chiropractic care or massage therapy. And those modalities need to have failed. So that's why you would need surgery to alleviate your symptoms. Now, under insurance, there are certain criteria that have to be met. Now, every insurance company is a little different, but in general, it has to do with your BMI, and that's how we're going to calculate how much breast tissue needs to be removed. So the amount of breast tissue that needs to be removed under insurance can be very significant, sometimes more than what your surgeon would like to remove or more than what you would like to have removed. So it's important to have that conversation, to be evaluated, to get an assessment that shows if you're a good candidate for breast reduction under insurance and if you would even qualify. But even with that, even removing a relatively small amount of breast tissue can alleviate someone's symptoms because the key thing is to reposition the breast so that they're not pulling you forward and creating that tension on the shoulders. So breast reduction is one of the most common procedures I perform. It's one of the most rewarding procedures for the patient and the surgeon because I love it when my patients say that the weight has been lifted. They can really get back to their normal activities. They can exercise like they haven't been able to do in years. So it's really a very rewarding procedure. And one of the concerns that I get a lot is that, will I still be able to breastfeed? Will I still have sensation in my nipples after a breast reduction? So the short answer is you should still be able to breastfeed because during the procedure, the nipple and the areola are not removed. So they still remain attached to the underlying breast tissue. So function should be preserved. And as far as sensation, I would say about 20% of patients do have altered sensation, which can be decreased after surgery, but it usually does come back. Typically, the more breast tissue you remove, the more you could have issues with altered sensation. But those are minor issues when you look at the big picture of removing that excess weight and really giving somebody their life back, so to speak, because they are able to do things that they haven't been able to do in years. So breast reduction, great operation.